Good afternoon, everyone, and thank you for participating in today's presentation by Transworld Systems, your cash flow partner. Rick Hust is our presenter today, and his background in healthcare specialist in the last 25 has had 25 years of healthcare specialist experience. I apologize for that. He lives here in San Diego and has since 1989. And his partner, Kim, his wife, works with him with Transworld Systems. And he has 2 lovely daughters and 3 grandchildren. And he really enjoys what he does at Transworld Systems. So we'd like to get you started with some poll questions and have you thinking about some information here as once he starts the presentation, and we will answer all of your questions at the end of the presentation. And please note that everyone is on mute. So I'm going to launch the first question here. And please just take a few moments to answer those questions. Okay, and we'll move into the second question. And the third question. Okay, I would now like to hand over controls and presentation to Rick Hust.
Well, thank you, Veronica, and it is an honor to be a part of the physician resource for Scripps Mercy. Great partnership, and you in particular, Veronica, you're a gem. So thank you for giving me this time to show you what I've done for the last 25 plus years, specifically in the healthcare industry. And I'd like to be able to show you some techniques, talk to you about how Transworld Systems can increase cash flow, cut down on some internal costs and frustration, and at the same time improve the bottom line profit and efficiency of your practice. So I'm going to get started by first our healthcare Creditors' Bill of Rights. Transworld Systems believes these, and I'm sure you will too. All providers should expect to be paid on time. Extending credit is a courtesy and should not bring financial or regulatory risk to a practice. Practices should be able to focus on their specialty, free from the burden of collections. Unpaid bills negatively impact everyone. And late-paying patients should be held accountable to their obligations in a dignified, in a lawful, and respective manner. And I'm going to talk to you about that, which is so important when you're dealing with the collection agency in particular, and the sensitivity of going after the money that's rightly yours. Who is Transworld Systems? Gosh, we've been in business for a long time, since 1970. We help over 20,000 clients in the medical field throughout the United States. We provide proven cash flow solutions for all practices of all sizes, from a single doctor practice all the way up to major hospitals. We work on a fixed fee basis, around $12 per account. That's on an average. We are a recognized healthcare collection compliance leader. That's very important. I'll get into a little bit about that, but that is so important in today's healthcare practices. We have been working hard to improve our clients' cash flow since 1970. So been around a long time, and you'll notice some of the names on the screen right here who are peer-reviewed, from the NRHA to the AMA, at the bottom, the MGMA. And we went through a pretty rigorous process, as Veronica can attest to be a partner with physician resource. I mean, there's 6,000 collection agencies out there, and they chose us. So they did extensive research, and I appreciate that. It's again, we feel that we work well together, and we can help you as well. We have 3 distinct products that I'm going to talk about. I'm going to take about 20 minutes total, and then have some room for some questions as well at the end. We have 3 distinct cash flow products. Accelerator, which is a first-party billing in your name. We have, and I'm going to talk about all 3 of these in a little bit of detail. We have the Transworld Systems Profit Recovery, which is third-party collections in a very diplomatic, dignified manner. And then we just have straight collections, where for those very hard, disrespectful people that just don't pay. So let me kind of show you, some things here. When you talk about a collection agency and making changes, it's hard to change. I mean, just in daily life, we get into routines, and it's hard to change things, especially things that are you've worked with for a long time. But possible reasons why you haven't made a change yet: you didn't want to lose control of your accounts, too time-consuming to find a new collection partner, and physician partners found you one, too much change already going on. Oh my gosh, I just read today that the ICD-10 now, starting next month, has gone from, 15,000 codes to 68,000 codes. So you talk about change and what's going to bring to the collections. It's going to be arduous, because you think that all collection agencies are about the same. Well, they're not. Especially us. We're different than any other collection agency that's out there. The interesting thing is, all collection agencies, and I brought this up before in a very short version of this, that all collection agencies are sanctioned under the same FDCPA, Fair Debt and Collection Practice Act. So if I'm going to write something down, I'd write this down. You don't have to pay a percentage, because all of us, every one of us, all 6,000 of us are regulated by the government under the same laws. Why pay a percentage if you don't have to? So let me show you what's so important about early intervention, why it pays off, and why you can use a company like Transworld Systems. Most practices will work the accounts in-house. They get paid most of the time. 95% of the time you're getting paid right here at 30 days. And then as time goes along, 60, 90, all the way down to 120, 150, it gets harder and harder to collect your accounts. Well, finally, after you've done everything in-house, you turn them over to a collection agency at about 150 or 160, where they're less collectible. And the reason why you've done that is you don't want to pay a percentage, and you shouldn't have to, or you don't want to alienate your patient, and I totally understand that. So what Transworld Systems said back in 1970 is, what if you could address your accounts right here at 60 to 90 days or 90 to 120 days, diplomatically, when it's a little bit easier to recover those accounts, open up the lines of communication with your patient, get them making contact with you, making payment arrangements or paying in full diplomatically, without you having to pay a percentage. If we can do that for an average cost of around $12 per account, you have to ask yourself a question: would that help your practice? If you had less collections and do it for a fixed fee, would that be more efficient? Would that help your profitability? So something to look at. So self-pay reasons why, most reasons you must collect as quickly as possible. Self-pay represents a bigger percentage of AR than ever before. People change insurance plans more often. Gosh, unbelievable. You are competing with commercial businesses. It's too expensive to keep billing and follow-up. More complaints come from those patients who owe you money. I bet you're smiling right now, too. And patients will go to another facility if they owe you money. So, and to stay in business, of course. So these are our, the different types of debtors that there are. There's the dutiful, they pay by the statement. There's the distracted, and then we have an accelerator product for that, where it's in first party in your name. And then the disrespectful ones who just don't pay from the reminders, they don't pay from all your statements, and they need a little nudge, right? They need the little third party. And then we have our professional collector for those very hardcore collections. So we have a complete system that takes it all the way from after billing, 30 to 45 days, accelerator, into profit recovery, third-party collections, and then collections. So I'm going to breeze through these next few slides here to get it in within the time frame. This is how the distracted, through our accelerator process, between $6 and $15 per account, depending on your usage, we will send out 5 types of contacts, five contacts. An initial letter stating that their invoice, their statement is past due. We'll make a phone call, live phone call. We'll send out another statement in your name, getting increasingly stronger. We'll we'll make another phone call, and then a final reminder. And a lot of practices use these because their billing company doesn't, or they're not using a billing company, or their staff is so busy, which most are, that they just don't have a good follow-up program in-house. And this is a good program, accelerator. Then we have the disrespectful patients where they need third-party collections. And that's where most of our practices fall into. They have a pretty good in-house process, but they have those ones that fall into the 120, 150, 180 where they need collections. And it's right here at the top, Transworld Systems collections, and we'll start a very diplomatic approach to collecting. We make 5 collection demands. You'll recover from many patients that pay as soon as the third party is involved. Again, it's a flat fee between $6 and $15 per account, depending on how many times you use this on a monthly basis. And the best thing about it all, if you can remember this one, all money goes directly to your practice. It's instant cash flow. It doesn't go to us. And people always ask us, how do you do it for such a fee of between $6 and $15? Well, there's 2 reasons. One, we work on volume basis. We have large companies from IBMs to Verizon, Sprint, Apple, hospitals, large doctor practices, and more importantly, the money goes directly to you, so we eliminate the middle person in collections. Okay, so there's no secret to it at all. We just have done it in a way on volume and on you being in control of your accounts. We even say thank you at the end, just thanking you for your business. Look forward to serving them in their future. So you have a complete follow-through in the collection process. For those deliberate debtors, those ones that you've done everything possible, you've turned them over to profit recovery, 5 demands, and they still don't pay, we have our national team of professional collectors will turn up the heat. It's just like a standard collection agency. We'll do skip tracing. We'll do asset discovery. We even have legal efforts. If we need to take someone to court on your instruction, we'll cause suit to be filed. We pay the court costs. We pay the attorney's fees. We pay all fees necessary to satisfy a judgment. And if we don't collect, there is no fee. And there isn't another agency out there that I know of that will pay all those fees and not charge you for it before they collect it. Okay? So very, very good benefit by using Transworld collections, or just the whole process. So here it is. You have your initial statement right here, which most are going to pay. You can use Accelerator to help your in-house staff on a constant follow-up process in your name, in your practice's name. For those who don't pay an accelerator, you have our third-party collections, 5 demands, or if you prefer, mixed media with phone calls here as well. And then, if all else fails, professional collectors. So a complete progressive stage approach to account resolution. Barron's, a financial magazine, which we love, has been around for years and years and years. In fact, Warren Buffett's one of his favorite financial magazines. Transworld Systems gets credit for the highest recovery rate in the industry. You can go to the American Collectors Association website, ACA, and you'll see that the collection average for the national average is 14%. Our national average is 56%. And the reason why, I can go back to that depreciation page, is because we get the accounts a little bit sooner. So, everything is easy to use. We give you an online client portal that allows you to see everything that you've turned over to us 24/7. It interfaces with most leading PMS platforms, and we have a free client launch and support team 24/7. So you'll be able to view everything that goes into the system, where it's at, what demand we're at. The only time we need you to do something is to tell us when it's paid so we can update our records. And that's just another great feature. And if we get a chance to talk and you're interested in this, we're going to be able to sit down and I'll give you a better demonstration of how it works. It's fantastic. Yeah, I mean, it's wonderful. Here are some of the PMSs that we work with. You probably recognize some of these, from Athena to Medisoft, eClinical, Peachtree, Allscripts. I mean, about every single medical practice management software we work with. We are a compliance leader. You know how important it is. HIPAA compliant, Fair Debt and Collection Practice Act, the Telephone Consumer Protection Act. I mean, there are so many regulations these days. If you're not compliant with these, if your collection agency isn't compliant, not only are they going to have an issue, but as you know, everybody gets involved in a lawsuit, and we are totally compliant, the leader actually in the United States. Okay, in conclusion, our solutions reduce internal expenses. We lower your days in accounts receivable. We have the fastest ramp-up time in the industry. We can start collecting on your accounts within 24 hours. We ensure 100% regulatory compliance, and we collect more money much faster because the money comes directly to you. Now, I'm just going to go through if I were to come into your business, I would do a complete analysis of what's going on, what you're doing right now. I would ask you questions about how your statements go out, when you consider an account delinquent, the average age, all those things, a complete analysis. And that's no charge at all. I want to be able to make sure if there is a fit, I'll tell you that. If there isn't, I'll tell you that too. Total transparency. Our pricing is PRC member preferred, which is better than anything you can get in the street from any other representative. Depending on your usage, like if you were to tell me we use you 5 times a month, your average count per cost per account would be $13.50 for 20 accounts per month. And the more you use it, the lower the price is. You see $12.50, 40 times a month, $11.25. So if you just looked at it and you said, you know what, I have about 10 a month, that would be about 100 a year. Your cost would be about $1,350 to take care of 100 different accounts over a year period of time. So kind of take a look at that, and again, I'm going to give you some information at the very end so you can contact us. And I'm wrapping up here. We also provide complete insurance resolution for those that are very, very slow, and as you know, they take time to pay, but we can speed that up. We go right to a supervisor. All collection demands go to a collection supervisor. So it's very, very important If you are running slow on getting your insurance claims paid, we have a product for that as well. So I'm not going to go through all these. If I came in, I would also look at your statements and find out, what's going on with how your statements look, so I could be able to maybe help you in structuring them so you get your clients to pay you. I would show you all the demands that we send out so you could look at them and make sure they're exactly the way you'd want to look, from our accelerator all the way through all our collection demands, so you are totally informed of how we're going to work. As you can see, as I've been flipping through these, we change the size, we keep them off balance, they open up the mail. We get very, very good response from our collection demands and phone calls. So that's kind of a real good overview of what we do. If there's an interest in just looking at us, it doesn't cost anything to take a look at how we might be able to increase cash flow and cut down on internal costs, give you some ideas that I've seen in other practices to help you collect more money without even using us, and build a relationship and help your practice thrive, especially during these very tumultuous times when things are changing. There's our email address and my office phone number and my cell number. And my wife and I, Kim, would love to help. So, Veronica, I'll throw it back at you if there's any questions.
Great. Thank you so much, Rick. If anyone has any questions, please type the questions in on the sidebar there in the questions tab, and Rick would answer those questions for you. For those of you who signed on a little late, please know that this webinar is being recorded, so we will have the webinar available on the Learning Center in the Physician Resource Center website in about 2 weeks. So again, if you have any questions, please type those questions in and we can get Rick to answer those for you. I'll give about a minute or so there. If not, then we'll go ahead and conclude the presentation.
And Veronica, thank you and the Physician Resource Center for allowing me to show this. I'm excited about how we can help the practices and maybe just relieve some of the stress that our administrators and worker bees are doing in their practices. It's crazy out there.
Yeah, we've received actually just this end of last week and this week some interest from offices regarding the issues they've been experiencing in their office, and so we've definitely mentioned Transworld Systems, so we've sent those leads over to you, and I'm sure you'll be able to help them.
Yep, I've already talked to 3 of them, and they're all all experiencing these things, so must be everybody.
Well, I don't see any questions here, so we'll go ahead and conclude the presentation. Rick and Kim Hust's information is on the screen. If you'd like to contact him directly, you can reach him at 619-298-7103, extension 31, or his cell number at 619-300-4150. And you can always contact myself, Veronica, at Physician Partners at 619-359-6600, and I can place you in touch with Rick and Kim. So thank